Hello, today I am going to explain how to prepare for an IVF procedure. So we have learned on who needs IVF procedure, and once the patient and the doctor decides that they are going for an IVF procedure, we need to prepare the patient before she gets her period so that she can undergo this procedure. In the preparation visit, we draw blood tests from both the husband and the wife for a series of tests, and these are called the IVF baseline test. So what the IVF baseline looks at is whether the woman is fit enough to undergo the IVF procedure. So prior to pregnancy, a lot of factors need to be optimal in the lady, and that includes her hemoglobin, the cell counts, the functioning of the liver, kidney, the basic human body, especially the thyroid hormones, the blood sugar status, and even certain vitamins, important ones such as vitamin D. It is also important, since it is a surgical procedure, to have a look at the infectious disease markers. So all of this can be done in a single blood sample drawn from the husband and the wife. The wife who is going to undergo the IVF procedure will have the detailed set of investigations, whereas the husband will have just the infectious disease screening if his semen parameters are normal. If the semen parameters are highly abnormal, he will have to do the hormone test also, so that we can prepare him with medications prior to the procedure to optimize the results. So once we have the entire set of investigations ready, we start the woman on many medications if required. For example, if she is found to be abnormal with regard to thyroid hormones, we will start the thyroid medications. If she is having a slightly lower hemoglobin, we will start her on iron tablets. Sometimes the sugars may be slightly raised. In that case, we start with diet and exercise and then move on to give tablets to control the blood sugars. Sometimes even the blood pressure can be diagnosed as high when they come to the IVF preparation. So everything that is related to her general well-being is optimized prior to we starting the IVF procedure. So once everything is done, we will also start her on a very important vitamin, folic acid. Folic acid is important to be started prior to pregnancy because the deficiency of this vitamin can cause defects in the formation of the baby, and this has to be corrected before the procedure starts. So this involves the optimization of the lady by detecting and treating the underlying conditions, by starting folic acid, and also lifestyle advice involving diet and exercise to optimize oneself for the upcoming pregnancy. At the end of it, we instruct the patient to wait for the second day of period, and on the second day of period, she is advised to come down to start the procedure of IVF. Thank you.